Hello, Medas Guardians. Today we will talk about a disease which purely attacks our gut called inflammatory bowel disease or IBD. This is actually not a single disease but refers to two related but distinct diseases. One is called Crohn's disease while other is called ulcerative colitis. It's often thought that IBD is an autoimmune disease, but researchers suggest that chronic inflammation may not be due to immune system attacking the body itself. Instead, it is result of immune system attacking a harmless virus, bacteria or food in gut causing inflammation which leads to bowel injury. As we read earlier that IBD is not actually a single disease but refers to two related but distinct diseases, so we will see location and extent of location of these two. Firstly, ulcerative colitis only affects the colon or large intestine, but Crohn's disease can affect the entire digestive system from mouth to anus. If we talk about extent of location, then ulcerative colitis involves only inner lining or mucosa, but in Crohn's disease, inflammation can extend to entire thickness of bowel wall and other layer of digestive tract. Signs and symptoms of inflammatory bowel disease or IBD vary depending on severity of inflammation and where it occurs. Some common symptoms of both ulcerative colitis and Crohn's disease are diarrhea, fatigue, abdominal pain, and cramping, blood in stool, reduced appetite, and unintended weight loss. If we talk about causes of IBD, then we talked in start of the topic that it is a result of immune system attacking a harmless virus, bacteria or food in the gut which causes inflammation and leads to bowel injury. It can trigger inflammation reaction in the gut, and some researchers consider that Escherichia coli to have a link with Crohn's disease, but there is no single confirmed causes of IBD. Instead, there are several potential factors that can increase a person to increase the risk of developing IBD. There are several risk factors which can trigger IBD. First risk factor is age. Most people develop symptoms before they were 30-year-old, but some people do not develop IBD until their 50s or 60s. Although IBD can occur in any race, but white people have more risk of this disease. Other risk factor is family history. You are at high risk if you have a close relation with IBD patients such as your parents, siblings or child with this disease. Cigarette or smoking is most important controllable risk factor for developing Crohn's disease. Smoking may help to prevent ulcerative colitis, but overall harm of smoking outweighs any benefit. Other factor is non-steroidal anti-inflammatory medications such as ibuprofen, naproxen sodium, diclofenac sodium. It can increase risk of IBD or worsen the disease in people who have IBD. Some people confuse between inflammatory bowel disease or IBD and inflammatory bowel syndrome or IBS. So we will see some major similarities and difference between IBD and IBS. First of all, we will talk about the similarities. Then they both can lead to changing bowel habits and pain in abdomen. They both also tend to flare up for short periods and then go into remission. Neither of the two has premature cure that can completely resolve the condition. So people mainly confuse IBD and IBS due to this reason. If we talk about the differences, then IBD is more severe condition that can lead to number of complications including malnutrition and damage to bowel. IBD occurs due to overactive immune system which causes inflammation to gut and GIT. This inflammation can be reduced by medications, but IBS usually happens due to oversensitive gut and digestive problems and cannot be cured by medications. For proper diagnosis and confirmation of IBD, a health professional should take medical history on first hand and then he will choose a diagnostic procedure. Some tests for IBD diagnosis are stool samples, blood test, X-rays, CT and MRI scans, and sometimes endoscopic procedures which include colonoscopy to examine entire colon, flexible sigmoidoscopy to examine section of colon, and upper endoscopy to examine esophagus, stomach, and first part of small intestine. Capsule endoscopy is another option which requires a swallow a capsule which contain a camera, thereby allowing a health professional to examine small intestine entirely. If we talk about treatment of IBD, then there is no cure. The only goal is to reduce symptoms, achieve and maintaining remission, and prevent complications. Common treatment of IBD involve medications on first hand, and the chronic stages require surgical treatment. Firstly, we will talk about medications. Usually, doctors prescribe drugs beginning with milder ones to more aggressive treatments later. Medications include anti-inflammatory drugs like 5-ASA medications are usually first line of defense against IBD symptoms, which reduce inflammation in gut and help a person to achieve and maintain remission. Other options is corticosteroids, which are test-acting anti-inflammatory steroids if a milder class of anti-inflammatory is not working. People should use these drugs short-term to treat flares. Long-term use of these drugs can cause IBD symptoms worse. Next option is immunosuppressants, which work by preventing immune system for attacking bowel cells, leading to reduced inflammation. However, they can take 3 months to effect and can have many side effects, such as increased risk of infection. Biological therapy is another option. There are certain antibodies that target certain substances that cause inflammation in the body. Some other medications include antibiotics and diarrheal drugs, laxative vitamins, and mineral supplements to overfill nutritional deficiency due to IBD. In some cases, surgery may be necessary to treat IBD or its complications. For example, doctor may recommend surgery to widen a narrow bowel or remove any fistula. People with ulcerative colitis may need to undergo surgery to remove colon or rectum. Those with Crohn's disease may need a procedure to remove certain portion of the intestine. Now we will discuss about some complications of Crohn's disease and ulcerative colitis, after which we will move towards surgical treatment, procedures, and surgical complications. So first of all, we will talk about Crohn's disease. Complications of Crohn's disease include bowel obstruction, malnutrition, fistulas, and anal fissures. Crohn's disease affects full thickness of entire intestinal wall. Over time, parts of bowel thickens and narrows, which may block flow of digestive contents, and it may require surgery to remove diseased portion of bowel. So the complications is malnutrition. Patient will have diarrhea, abdominal pain, and cramping, which make it difficult to eat something, and intestines to absorb nutrients. So anemia due to vitamin B12 deficiency occurs. Sometimes fistula is formed due to inflammation which extend to intestinal wall. Fistula around or near the anal area is most commonly found. Anal fissure is small tear in tissue that lines anus or in the skin around anus, where infections occur and often associated with painful bowel movements and lead to perianal fistula. Now we will see some non-surgical complications of ulcerative colitis, and then we will talk about surgical procedures, treatments, and complications. First complication of ulcerative colitis is severe dehydration because of excessive diarrhea. Second complication is toxic megacolon, in which colon rapidly widen and swell. Third complication of ulcerative colitis is perforated colon, which is commonly caused by toxic megacolon, and it may also occur on its own.